all about sporting injuries. The hip and pelvis. Bursae around the hip and pelvis. The one over the greater trochanter is the most important, bursitis, middle-aged women. The one over the iliopsoas can also be inflamed and be painful. MRI showing AVN of the femoral head, segmental AVN of the femoral head. Anterior hip dislocation emergency needs to reduce as soon as possible to avoid AVN. Anterior hip dislocation shows on the plain X-ray. Here's a successful attempted closed reduction. Posterior hip dislocation, same principles. Fracture of the anterior pelvis will need fixation and stabilization. Posterior fracture dislocation of the hip will need ORIF. Fracture of the neck of femur in a 42-year-old needs emergency fixation. Fracture of the pelvis, ruptured urethra. You can't put a catheter into the urethra, you have to put a suprapubic catheter in. So blood at the tip of the penis means a fractured pelvis. Avulsion of the ischial tuberosity. Fracture, displacement of the anterior pelvis needs stabilization. Check the posterior elements. Fracture of the femur and the Dolmay splint will need a nail to be placed. External fixateur placed for fractured pelvis. Fracture of the femur fixed with the nail up and about at 2 days. Stress fracture neck of femur, watch carefully, may need fixation. Pain of the adductor tendon, groin strain, and again and again. Pain and tenderness of the ischial tuberosity, teenagers can be painful, too much sport being played. Pain with resisted adduction. Pain with resisted flexion, snapping hip, and again and again. Hot bone scan, trochanteric bursitis. Iliac crest showing you can get an apophysitis here, inflammation. Arthroscopy of the hip showing a labral detachment, and again, MRI showing quadriceps hematoma contusion. Tenderness of the mid to lower quadriceps is a partial rupture of the quadriceps. A young patient may well need surgical repair. Here it is again. Myositis ossificans, bone formation, and a quadriceps hematoma. Differentiate from a tumour. Entrapment of the ilioinguinal nerve in the groin. Main nerves around the hip, sciatic at the back, femoral at the front. Obturator entrapment. Numbness in the thigh, and again. OA of the hip at arthroscopy. OA of the hip on X-ray and the skier. Tender of the AIIS. Bony avulsion there. Bony avulsion in the region. Bony avulsion, ischial tuberosity. Just to conclude, hamstring injuries, football, cutting procedure, and tackling with resisted extension. Thank you for your interest in this presentation.